Your doctor breaks the news. You have cancer. And now, the next step is to see an oncologist. Your shock and disbelief turn into fear and desperation. You've heard stories about the horrible side effects of chemotherapy. What happens next? What can you expect? You fear this totally unknown experience. Hello, I'm Ellen Baker, and this is Oncology Podcasting. In this podcast, we'll help put your fears at ease by taking you inside a medical oncologist's office and showing you what to expect. First, you should be aware that an oncologist is a physician that specializes in the treatment of cancer. Often, an oncologist will assume full responsibility in managing and coordinating the appropriate treatment modalities for the patient, such as chemotherapy, radiation therapy, surgery, and other specialized treatment. When you first arrive at the oncologist's office, the receptionist will greet you and sign you in. You may be asked to complete basic paperwork at this time as well. At your appointed time, a medical technologist will escort you to a treatment room and take your vital signs, such as your blood pressure, pulse, and temperature. The technician will also measure your height and your weight, which are important factors in calculating the chemotherapy dose that is appropriate for you. Next, you will be seen by an oncologist who will examine you. He or she will review your clinical information, lab results, and any imaging tests that have been performed, and then will evaluate your disease. If necessary, your oncologist may order additional blood work and tests to help determine the specific stage of the disease. Staging is important because it gives your oncologist an idea of how aggressive the cancer is. It helps him select the best treatment option for you. He or she will discuss with you and explain to you the different recommended treatment options. There may be situations when you may not need any additional treatment, or when the treatment required is not actually chemotherapy. If you do need chemotherapy, your oncologist will explain what chemotherapy is, the drugs that will be used, the pros and cons of the treatment, and the recommended schedule of treatments and visits. Your oncologist will also discuss with you the side effects to expect, how best to manage those side effects, and any other drugs that will be involved in your treatment. For example, a newer classification of drugs called targeted therapy is commonly used in conjunction with chemotherapy. Targeted therapy acts by preventing cancer cells from growing and spreading. Your oncologist may also discuss with you any ongoing research or clinical trials that are available for your cancer. Should your oncologist determine that chemotherapy is the right treatment for you, you will next see an oncology nurse. Oncology nurses are nurses who have had extensive training and experience in administering chemotherapy drugs. Many oncology nurses are specially certified in nursing care for cancer patients.